Good morning. It's awesome to start the day in this room. When you sneak in, you don't get to look at who's in the room. So now I get to see such familiar and great faces here. So many good partners to myself and the department. So thank you all for being here. A few brief remarks. I want to start by saying that you'll hear from me today that it's my perspective we haven't done enough, but it's my commitment that we will work with you to do more. And so I just wanted to start by acknowledging that. I think because of some of the challenges the department has faced, we've come to this already behind and have some catching up to do around how we can ensure that all vulnerable Rhode Islanders have access to benefits, and in particular, the group that we're talking about today. So a few things that we have done, and it will give you a sense for how I've prioritized our thinking around this. One is to ensure that the staff that work for me in our field offices understand the rules and aren't affected by the propaganda that so many people are hearing. And so our priority first has been really to train our staff and to be sure that we are reinforcing what the truth actually is and ensuring that we are not, that fake news is not affecting the way they are talking to our customers or administering benefits. And that's a challenge. We've had tremendous turnover in the past 2 years. I like to talk about how I think at one time was a perspective that, if you work in a DHS office, you just sit at a computer and push a button and the computer spits out a determination that is right all the time. My staff, as most of you know, have to understand the most complex series of policies that I've certainly ever experienced. And so when you look at what we've had to do over the past couple of years, where we have onboarded a tremendous amount of new staff, we are bringing them up to speed just in their general policy knowledge, but also now layering on some more advanced training around rules pertaining to immigrant families and to ensure that they have guidance at their fingertips, supervision and support as they're talking to families in our offices. And that's going to be an ongoing commitment of the department to ensure that that folks are protected and that we know the rules. And our job is to administer the programs as they are laid out in statute. So I have to really be sure that people understand that. Second, I want to ensure that our customers understand. And so we have taken some steps around signage in our offices and trying to communicate. If you've been to our offices, they're generally terrible. We are working really hard to change that, and I hope, if I'm back here next year, you'll be able to acknowledge that the way a DHS field office looks and feels is a lot different. We're moving out of a lot of our spaces. We're hoping to build more family-friendly, community-based settings. It took a first step in Middletown in doing that, but we'll be doing that across the state. In doing that, it allows us to better communicate to people, to ensure that people are able to interact with our staff and are, walking into massive spaces that are seasoned people. So we've taken the first steps given the kind of physical bones that we have, but I think you'll be pleased with what you see from the department in this space more broadly for people that we serve in Rhode Island, but I think it will also help this conversation. We also have been working really hard, literally over the past year, to redo what is lovingly referred to as the DHS-2, which is the terrible application that the department uses to ask people to apply for benefits. If you've seen it, it's like 45 pages long, literally. And so it's really hard to communicate to people about the programs in the context of a 45-page application. It's very overwhelming, especially if English isn't your native language. So we actually just submitted a revised version of our assistance application, which we'll now call it, to the feds for feedback. Some partners have seen it, and we will do some more thorough community vetting with it after we get federal feedback. But throughout that application, we've tried to reinforce for immigrant families what the rules are for different, very clearly, for different populations. We've thought about issues of reading levels and how people consume information, shocking. So we are trying to ensure that in all of our materials, we are reinforcing what the truth actually is, and that our families can see that and benefit from that. is that at the end of the day, we are the government. And so I, carry close to my heart the fact that no matter how much I say, we care about you, we want to take care of you, the skepticism families have around me and my department and the government is real and fair. And although my instinct as a social worker is to want to chip away at that, I think very carefully about protecting that for families, because in the current state, that fear in some cases is real and good. And so the way I work through that is to think about how we can better partner with community agencies who families will trust, can trust, and in some cases can maybe protect them more. And so the department has taken some first steps in our work with community agencies. I'm not someone who has a perspective that you should have to access our benefits by coming directly to us. And it's been a difficult thing given the other work we've been doing, but I think in the next year we will be in the space to continue to grow that so that families can access the portfolio of DHS benefits through our community partners. They don't have to come to DHS. And that we can have agreements with partners so that you know our policies and procedures and you feel comfortable and you're able to relay those to customers, but they don't have to ever set foot in a field office if that is something that is too frightening for them. So those are the kind of big buckets of things that we're doing. I would say, just in terms of things that we want to do, I think it's growing a lot of that, expanding our partnerships, thinking about how we support people who provide services on our behalf. So most specifically, we've been talking about how we can support our network of childcare providers around safe space training, and Linda had shared with me some materials from class that are excellent. So thinking about how we can use our power of convening and as a funder to reinforce the kinds of both consistent messaging, information sharing, and best practice sharing with providers across different areas. So we'll be doing more of that. And to the point around being careful about the kind of data we collect, it's something that is on my mind. I'm not going to talk a lot about it here, except to say that it's on my mind. I take very seriously the idea that although I may have a lot of thoughts and feelings and things I want to do, I also want to be sure that I'm not setting us up. I'm not poking the bear unnecessarily, because it's not maybe my role. And I don't want to make us a target because we misstep or overstep or are perceived as doing that. But I will say to you that I am personally thinking very carefully about how we collect data and how we don't ask for things that we shouldn't be asking for or collect things that we don't need to collect. And we will continue to look at that and take that forward.